So I had my septoplasty surgery done on Wednesday. It's Friday now, so the 10th, so 2 days ago. And I thought I'd film something about it just so I can kind of look back and be like, okay, that's what happened. Yeah, this isn't actually, it's not necessary really, the little thing, but it just means my nose dribbles. So basically, the symptoms I was having beforehand were couldn't really breathe that well through my nose. Um, but the main thing was I was getting like loads of mucus at the back of my throat, so it was making an infection. The doctor was like, let's do the let's cut it all, make it all better, whatever, make it straight, septoplasty. So I had the surgery at like 2 o'clock. It was super quick. It feels quick, but it was quickish. So I was probably under for about 45 minutes. Came round 45 minutes later, just like so an hour and a half. I was probably out. And then obviously you have these, I'm not sure, kind of splint things in each of the nostrils, and it's very uncomfortable. So they lie down on a bed, pretty much. I can't breathe through my nose still. It's 2 days later. It doesn't hurt. There was like no pain really, except for when they were taking them out, which wasn't really that painful, and like a headache. I had a headache the whole night. The main thing for me was I didn't get any sleep. Basically, I didn't get any sleep the whole night. Like for the first night of the surgery, so on the Wednesday night, I literally slept nothing. But that was more to do with the fact that when you have to lie back and you can't lie on your side because all the blood will just drip out. So you lie straight and have a slight deviate, like a slight raised bed. And they had to. What was my own thing? And every time I nearly fell asleep, my own throat, because you have to breathe through your mouth, so that's the main thing. So like you wake up all the time because you can't breathe through your nose. But otherwise, it's like no pain. The bleeding is still happening, but barely now. It's gone down a lot. I don't know if you can see that. That's like the second day. Really have no idea. So there's not much. But I do wear that because otherwise it just kind of dribbles out. And I'd rather not wear a tissue. So I took 2 days off work, so Thursday and Friday. I don't have to go back until Monday. But as you can hear, my nose is still blocked. The doctor told me not to blow my nose really. And just let it leave. He said it might feel like it's blocked, but then you can kind of hear it. It might just be the swelling. He said it's more likely to be the swelling rather than it actually being like loads of mucus or crap in your nose. So I'm quite happy to not blow. I've got like water tissues. He gave me some more of these gorges so I can make more of these nose things. A spray to keep my I guess it's like a seawater spray. I'll do that every 3 hours, and then some other drugs, which is like anti-inflammatory and like just painkillers. So basically, swelling, like as you can see, there's no like swelling or anything like that. At least outside, it's all inside. I think there's a tiny bit of swelling, but it's not too bad. And then last night I slept a lot better than the night before. So the first night I got like zero sleep. Last night I got a lot more. All I'd recommend is don't drink from a jug that big. Try and get one with a small thing, because like a bottle. Because when you drink and you've got this on, this whole thing got soaked. So I had to wake up and change that during the night. I guess that's it. I feel like for me at the moment, the back of my throat, like all the way at the very back, was where I had my main problems. So where all the mucus is building up, and that's gone. So I kind of hoping that the surgery. They also flushed out my sinuses. I'm hoping that the surgery sort of helped. I'll find out. Anyway, day 2, I guess, and I still can't breathe through my nose, and it's still bleeding. I think that's the fundamentals, but there's no pain. Good.